So my name is Magdalena Plimpton, and this is my Practicum project presentation. My Practicum project was completed alongside the nonprofit Give Hope Fight Poverty, and the title of my project is Reusable Menstrual Pads Project. This Practicum is the culminating piece to accomplishing my master's in public health from Liberty University. So I hope you enjoy. We will begin with an introduction to the nonprofit and project. So Give Hope Fight Poverty is a 501c3 nonprofit organization whose mission is to foster philanthropy domestically by designing service learning programs that engage U.S. students and professionals with rural communities in the Kingdom of Eswatini, Africa, and work together to educate, empower, and lift orphaned and vulnerable children, particularly those living in child-headed households, out of poverty. The practicum involved a preliminary exposure trip to Eswatini, formerly known as the Kingdom of Eswatini, in March of 2025. The purpose of this trip was to learn about the needs of impoverished communities in the country. Eswatini is a landlocked country about the size of the state of New Jersey. While traveling with Annie Todt, who is the founder of Give Hope Fight Poverty and the preceptor for the project, I was able to discuss possible practicum project ideas. I was looking for a project that could combine my sewing and designing abilities with the public health need in the country. Annie explained that the nonprofit was in need of some support for a sustainable period product option. Further discussion with Annie led to my project, which I will expand on in the coming slides. So next we'll look at the purpose of the practicum. This project was multifaceted. My purpose statement for the project is to personally test reusable menstrual pads, determine a best practice version for the needs of the nonprofit, and use the findings of the testing phase to develop an instructional guide to be used for replication of pads in the target communities. Alongside Annie Todt, my preceptor, we designated 3 objectives to guide the project. The first objective states that by May 16th of 2025, a comprehensive review of best practices for reusable menstrual pads and menstrual pad underwear will be accomplished to benefit the efforts of the nonprofit organization Give Hope Fight Poverty, measured by a literature matrix. The second objective states that by June of 2025, a best practices RMP, or reusable menstrual pad, prototype will have been created and tested, measured by a data log, including information from 2 menstrual cycles. The final objective says, prior to Annie Todt returning to Eswatini in early July of 2025, a complete instructional guide for sewing RMPs, a carrying pouch, and underwear will be finalized. This objective is measured by feedback from Annie Todt, the co-founder of Give Hope Fight Poverty. Moving along to the design of the study. The design of the project varied for each individual objective. The first objective prepared the student, myself, for informed work. A literature review was used to develop the final literature matrix, which became a tool for easily referencing background and supporting information for the following objectives in the project. Objective 2 involved testing prototypes and used data tables for collecting pertinent information to enhance the design of the final RMP recommendation. And then the design for the final objective is an original literary piece describing instructions for recreating the recommended pad. The format of this piece is a PDF. So here is an idea of what the literature matrix from Objective 1 looks like. Keep in mind this is just part of the literature matrix. Here's an image of the data table from Objective 2. This is specifically from the second menstrual cycle used for testing, and the goal for this second testing cycle was to find the recommended number of pads for a girl or young woman in the country to have. This is an idea of the finalized instructional guide, which came with a corresponding pattern piece packet. Now we'll move on to some more details on the accomplishments of the project. As you may know now, the main accomplishment of the Practicum project is the tangible instructional guide. This will be the focus of the accomplishments portion of the presentation. But first, outside of the instructional guide, I developed an easy-to-understand pattern pieces packet for the user and sent examples pieces to the founder for her to take along during her trip to Eswatini in July of 2025. This examples packet will be used for additional support during replication and to understand the instructions. So on the right, you'll see an image of the RMP pattern. This pattern was adapted from the Girls for Girls project by Dawn Malcolm. It was a chosen design following the testing phase that spanned 2 menstrual cycles. So the following slides are pages from the instructional guide itself. And remember that this is not all of the pages of the guide. It was about 23 pages in total, so I've chosen a couple to highlight. So on the left, you'll see the cover page for the instructional guide. And then on the right is a welcome page that explains what the reader will find. And then the final page on this slide, page 2, is the table of contents. One of my priorities for the project was to include educational pieces on why clean and safe menstrual products are important. So this is seen on page 3. Then on page 4, you see a brief introduction to the 3 pieces that will have instructions within the guide. On the right side, you see the materials needed pages. Page 8 is the step-by-step instructions for sewing the RMP. As you can see, I kept the wording clear and simple. I used pictures to support the user's understanding. The instructions for the carrying pouch and underwear are formatted very similarly. Now moving on to the recommendations portion. This project is merely a stepping stone for a greater need in Eswatini. My project did not involve research on hygiene practices or cleaning methods for the RMP. While testing, I attempted to simulate Eswatini washing practices based on my personal observations and hands-on experiences in the country. While testing, I hand washed with bar soap and air dried in the sun my used pads. Eswatini communities use green soap, which comes in long rectangular forms, just like the picture provided. Additional research on cleaning practices is recommended to support young girls and women in the country. Next, feedback and follow-up research is recommended for any necessary edits or changes to the instructional guide. Then my final recommendation is a follow-up on the materials available in the country. The final piece to my Practicum project was developing a spreadsheet for the preceptor regarding the availability of materials in Eswatini to sew the RMP, carrying pouch, and underwear. Ample contact with store representatives was accomplished, however, ensuring that the necessary materials such as the polyurethane laminate fabric, otherwise known as the waterproof fabric, various cotton fabrics, and elastics are accessible to Give Hope Fight Poverty stakeholders and other personnel. So finally, my reflections on this project as a whole. Going into this project, I was excited to utilize my academic background in public health alongside my childhood passion for sewing and designing. On a personal note, I was surprised to see the effectiveness and comfortability of the reusable menstrual pad products. This project opened my eyes to other menstrual health management or menstrual health hygiene management reusable products. Additional research is necessary to see if the RMP is an effective alternative for young girls and women living in poverty in the beautiful country of Eswatini. So coming away from this project, I have a greater understanding of the barrier that menstruating can be to females living in poverty. Without proper menstrual health management, girls may be forced to stay home from school. This will ultimately affect their education. As well, without proper menstrual health management, women may be forced to stay home from work, and this will ultimately affect their livelihood. Overall, the literature review found that menstruating women who live in poverty may face shame and abuse due to a natural and necessary process. I'm excited at the thought that my work may positively affect the quality of life for women in Eswatini. Lastly, I want to thank God for an incredible practicum. Working with Give Hope Fight Poverty was truly an invaluable experience. So thank you for listening to my presentation.